cordial relation with the employees, his employer. So how to handle the industry, how to manage, how to solve the problem. So as I said, in the academic field, maybe a safety valve theory means otherwise whistleblower role also might have taken. What person is standing before us at the same time. So now we are having the morning time, but as far as I understand, in United States, maybe midnight. So the difficult time, the midnight, he was standing with us to deliver a wonderful experience. I must say like that, and also share his own vast dynamic experience he achieved so far in different fields. So such a wonderful internationally reputed person standing before us. Then I tell you that he made many
is going on around them, often getting blamed on them, but the truth is that they are not the true culprits of anything negative that is happening around, which I had been spending a lot of time in discussing with them, interacting with them, encouraging them, motivating them, so that they can look into their future and see where they are and what they want to be and how they want to be. So particularly the student population who is with us today, I personally welcome them, and I'll be targeting more discussions to you as it applies to you. And also the faculties who are there. I'm not saying you are less important, but we are here to support these youngsters so that they can find a better future. At least they have a dream to pursue. Right now, Alex Matthews sir has given a very good introduction of mine. My name is Thomas George Mottackal. I am from the town of Idayarmula, and Dr. Jasi Matthew is my family member. Also, I started my career with the Indian, so I'm a soldier. And I later on moved on to Africa, working in various, these two disciplines, which is marine life and manufacturing life. From there, I came to the US in 1994, pursued a career in engineering, but God was good to put this corporation in my lap, and it was steadily growing since its inception. And the simple reasons are the commitment, honesty, and dedication. And I'm very honest in saying that. I'm not just sugarcoating the words. I hope you will be comfortable in English. I can do English, I can do Malayalam, I can do Manglish. So,
okay, sir. We can continue in English, sir. The teachers and students and all. And
all right. So right now we are going through a pandemic that is scary from one angle, but also it is a big opportunity from another angle. So I think, am I sharing or the organization? Can you see this slide introduction?
yes, sir. Yes, sir. We can see.
Yes, sir. Yes.
Okay. Talk to you from the perspective of a person who is living in the United States. I don't have to teach you, any one of you, about COVID, because you had been facing it just like I was facing it. You had been going through it just like I was going through it. So whatever knowledge you have is same as the knowledge I have, but there is a perspective difference. So as he was speaking to us, he said one thing, and I was amazed and astonished, surprised and angry to hear his statement. That he said that the regular flu is taking away 37,000 people from America every year. And this is expected to be another 3,000 people. And this country is not going to shut down or stop for that because this country is not built for it. This is word to word. Spain and of course China, they were going through the extreme situations. And UK was getting shut down, France was getting shut down, Italy was getting shut down, but America, President Trump said, I'm not shutting down. But the number 3,000 came from China. They said that they lost 3,000 people to the pandemic. So here our thinking was that, well, we can keep it below 3,000. But that was not the case. A lot of people died. But still the way it was handled, it was a failure in the beginning, but we learned a lot of lessons from that. So is about 15% of the world's disease population. But India has about 20% of world population. But our case, so our caseload was about 15%, while our population is 20% of the world population. So India did better in that sense. Comparing to America, it did much better. So total reported death in India is 441,000, which is 10% of the total worldwide death, which is also with a 15% population. It is 20% population. The death population is 10% only, which is also a good sign of managing it in India. So in fact, I should say your country is much better, doing much better than our country. But I will, as we go forward with this discussion, we will also see how our country, I mean USA, has performed certain things for a better way. And looking at our particular state, Kerala, is total reported case in Kerala is 4.25 million, which is 42 lakhs. And total reported death in India is only 21,000. So India is already doing much better and Kerala is doing even better. That's why I brought out those numbers. So the Kerala healthcare system, from a disease standpoint, Kerala is doing very good, even with the present hype in the numbers. In fact, yesterday I was just looking at the statistics. In India, it is only 34,000 cases in a day, of which 26,000 are in Kerala, which is 26,000 out of 34,000 is almost 90%, 80% also. So 80% of the, and I think Kerala's healthcare professionals must be wondering now why, but they can wonder all they want, but it is their responsibility to find solutions. Moving on. This COVID, our discussion today was to talk about the economic and social challenges that we are facing because of COVID. I know that Dr. S.S. Lal has spoke yesterday, and with his eminence in the industry, in the field, I definitely know that I cannot go into his domain because he is an expert. So, but talking about business, economy, and social matters, we can take a little journey into that right now. First, let us look at the challenges before we go into the opportunities. As you can see on the slide, in India, unemployment jumped from 2 to 3% before COVID to 6 to 7% after during COVID. COVID is still ongoing, which I have seen personally when I was there. I was in Kerala from November through July 16, I left. So during that time, I have seen how people are suffering. We will go into the detail of that later, how the lockdown and other things are affecting. But this is one big challenge. The people don't have job. So it is much higher unemployment among young men and women, higher inflation. The rupee was 59 to a dollar in 2014-15. Now it is 73, 74 to a dollar. People who are living in India, they may not always worry about this, but we do see it, and it actually, whether you worry about it or not, it actually directly impacts you. Look at the oil. Oil is sold in dollars, and the moment a certain currency is converting at a lower or higher rate to a dollar, which is taken as the datum currency. So obviously the purchasing power of that particular currency goes down or goes up. In India's case, it is going down. And that is why all these fuel prices and other commodity prices go up. Now India is an international market. The older folks who are joining me today, they know how India used to be 25 years ago. It was an exclusive local market. But now you walk into the city, try to purchase something. Most of the things that you buy could be Indian, could be Chinese, could be from other country. So India has become an international market. Obviously, the trade is done through international currency. So rupee's depreciation against dollar it's actually biting the general public. And leaving it there too, let's move on since we have other things to discuss. The most importantly, GDP. And all these things are known to you, and that's why I don't want to take much time. GDP, it was already at a very low stage in fiscal year 17 onwards, where it fell to 4%, and which has come to minus 7.3% in fiscal year 21. These information I'm depending on online resources. So if this information is wrong for whatever reason, it is not my making, or nor I have any intention to alter or amend any information that is given here. Up to that point, actually, it is all familiar thing. But now the next point that we should be discussing and thinking about is the lower product demand. I don't have to go into complicated discussions here. You all know the given dynamics where the government order shut down the shops, shut down the factory, shut down the office. What is actually happening? The country is coming to a stop. The state is coming to a stop. It is a duty of the managers of the state, which is the ministry and other people who are responsible, particularly the IAS machinery, to keep the country going forward. Anybody can stop, anybody can shut down, anybody can lock down. That's easy. But to keep it going in front of the challenges is difficult. For that, you need some brain. And unfortunately, many times, no offense to anybody, but many times when I look at the way it is, sometimes I wonder, these people have, they are supposed to be the high IQ IAS folks, but an ordinary undergraduate can do certain things better. So actually there is a real call should be there out to demand from these people, these managers of the economy, managers of the state, to find better ways of handling. I'll just give an example. I have seen recent news items saying that government want every shop to be closed, only, or the shop will be opened only for 4 hours. So another argument that came was, assume that there are 100 people visiting a shop and they came in 10 hours. That means per hour, you have 10 people visiting the shop. Now the shop hours are reduced to 4 hours or 5 hours. Naturally, per hour, they have, instead of 10, they have 20 people, which is actually increasing the chances of contamination or chances of spread. And can the IAS folks not think about it? These are questions that we have to ask ourselves. That why the people who are paid to manage these things are not managing it efficiently, rather than going very conventionally. With also there for you to think about it, for you to tell me that I'm wrong, or for you to tell me that I'm right. But whatever I said is for what it means. Then we also had, because of all these lockdowns and other things, we had a lot of supply chain disruptions. Even in the US, if you go to the big supermarkets, I can see a lot of shelves are empty. So what about India? A lot of manufacturing has come to a halt. Obviously, their revenue has come to a halt also. Think about a certain factory which has so many people working, and in a given month they have to give so much amount of money in salary. And that salary has to come from, not from his home, the owner's home, but has come from the product sale. But if the product nobody's buying, or the product they cannot sell, what do? So it is also the responsibility of the managers of the economy or managers of the state, the CEO, who's the chief minister, prime minister, downwards to other officers, to manage it in such a way that everything goes smooth forward, which obviously in this kind of pandemic situation, it cannot be as smooth as you want it to be. But what is your effort to make sure it is smooth? We will go into a little more detail on those things later when we discuss about challenges in detail. But another challenge our people are facing is income reduction. Many of them lost the job. Many of the businesses went out. Shops like restaurant, etc., cannot be opened just like that. If they are open, they have to stay open because they have a lot of running things. So many don't even know what happened to them, because Kerala has a particular culture from many years or time unknown, that failure of a business is a non-news. When somebody has invested money selling his wife's chain and every other possessions they have, or pledging every other possession they have, brought that money, started a business, we do not get any help from any governmental agency. Everybody tried to harass you, and at the end of the day, if this business is failed, what happened to that family? Whether they went and committed suicide, or whether they are facing problems with heavy debt, is all something to think about. Usually, it is not a news for the media. It is not a news or concern for the political side of the state, that any person who is doing a business is a thief, so he should fail. But the young people who are listening to me today, they should know that these businesses are not your enemies. They are your friends, and you will be one of them one day. You have to make way for it right now. You have to struggle to get those rights, that you people, you youngsters, have all the right to think about a business, do a startup, and succeed with that startup. So I'm mixing the COVID situation with the social situation in India, particularly in Kerala, with this belief that every business must fail. And when a business is failing, that's a success to the community. No. When a business is failing, that's a failure of the community. And young people, rather than looking for a government job or celebrating when you're getting an LD clerk job, you should have your own dignity to start and run your own business and be successful. And government has to, it is the duty of every government in the world to make way for such business, such startup, and succeed with it. I was discussing with a professor the other day that in the US, if somebody is learning economics, he will become an economist. In Kerala, somebody is learning economics BA, become bus conductor or LD clerk. Why not economist? That's a change that we want to see. Although that is not the subject, the core subject here. Let's move on. Another challenge that we are facing is travel and tourism. The travel industry has completely ground to a halt, and nobody knows what's happening. In the last 2 months or 3 months, how many news you must have read that the flights from Kochi to Dubai is going, not going, going, not going. From June 5th or so, it was going to start, then it's not starting. Then they said 23rd, it was starting, then not starting. I mean, the uncertainty. Emirates flights were operating with 5 people in the flight. Sometimes once it was only 1 family in the flight, the whole flight, whole Boeing 777 flight. How much money the airline is losing. And people who have their job in Dubai there. So those type of economic challenges, I think we have gone in detail about it. So those kind of economic challenges are real challenges, but we'll also discuss what are the possibilities and how we can go around that and how America had been going around it. The other challenge is educational challenge. These are what you see on the slide is the statistics, again, from online resources. 166 countries have implemented countrywide school and university closure. I think in Kerala, next month, they are starting the colleges. And as of now, everything is closed. I think the online education, but we talk about online education, but are we really able to do that? Or we just say this is online? How many professors or teachers are trained to handle online education? How many of what kind of resources government has offered to these teachers? I was there about 8 months. I never heard of any effort by any government, Department of Education, Department of Technical Education, or professional education, or medical education. Nobody has organized anything to help these. If I'm wrong, I'll be happy because I know something is going on. It also says more than 1.52 billion students are currently out of school or university, representing about 87% of the world student population. Can you imagine this? When we see these things happening, it is we think that okay, we are moving forward, and with all this online education and the exam, still 99% passed. It is very easy to say somebody passed or failed, but with this type of education that was happening, that was for which the teachers were not even trained for, what do you mean by pass? For 12th grade, I think 99% something passed, or 95, some big number. For 10th grade, I think 99% passed. Anybody who went by the school or saw the school or took an admission in a school all passed. That simply represents already there was a lack of knowledge among students. Education is to educate, not to get a degree or a certificate. We have a tendency to say that these kids are getting educated to get a certificate. No, let me tell you, my young friends, that your certificate is not going to do anything if you do not know the subject. If a history graduate does not know history, in Kerala it may be possible to become a government official, but not worldwide. If you are a historian, you must know history. So if the history is not drilled into your head and you are passed, you have a degree from a university that has no competition. So we sitting in the US attach zero value to that, because a university with a zero competition, say MG University and Kerala University or Calicut University, all these three institutions or even CUSAT, is all owned by one owner. One owner owns all these universities. There is a competition. When there is no competition, where is a motivation to teach better? So you learn something and just study exam based, and you will get a degree. I can remember the time when I was in the school, 160 students in my batch appeared the SSLC exam and 33 passed and 3 first class. Only 3 kids could make more than 60% out of 160, and only 30 kids qualified to go to college. Whereas that is not the case today, so I don't have to dwell on it. You know what it is. And this is actually making the knowledge base of the students to suffer a lot. So the education industry has to get alerted and become alive to address this issue. And the managers of education in the state should help you people better to change that situation. Moving on from the social side. So although we said that socio-economic challenges we talk about, but also I dwelled into education a little, because that is one of the major challenging areas. It was already a challenged area, but now it has become more challenged. Earlier, at least there were classes, you could see your teachers and you could interact with them, you could ask them questions. Now you are trying to study through devices that you are not even familiar with, study through devices which your parents cannot even afford to purchase. Even the school students, school children, they have to have a smartphone at least. Even with a laptop computer, it's difficult for me to handle things. So how about children studying with the help of a smartphone? So they are not going to pay a lot of attention to that. In any case, let us move on for the sake of time. Social challenges are more than whatever we talked so far, because I know that people went through a lot of difficult situations through these lockdowns and things like that. So since you cannot go out of the house, and with all that difficult environment, honestly, I can say that what I went through in Kerala, I will never go through in America. Although we had more death, we had more cases last year, not now. Now we don't even need a face mask here. So environment, I cannot really say that was more successful or this is more successful. Which one, I do not want to comment on that. But there was a social isolation. There was a social networking issue. You cannot meet with your friends. You cannot have a cup of coffee with your friend. You cannot come to school and get out, go to an ice cream parlor, have an ice cream. All those things were creating the bonding, and that bonding is lost. Now that bonding is only on the smartphone, and the smartphone bonding is limited to or going all around Instagram or WhatsApp or Facebook, things like that. all these things have a negative impact also, which probably in another situation we can talk about it. But there is a flip side to the whole thing. When you are not too much outside the house, you are too much inside the house. Like our fathers or grandfathers or great-grandfathers lived. They were having a home. 90% of the time, they will be available in their home. At that time, there was no phones. You cannot call somebody and tell them that I'm coming to meet you. People just walk in. And the 90% chances are, or 99% chances are that you will meet them in their home. But today, if you had to visit somebody, you have to make a phone call and confirm that they are home. Then only you can go. Otherwise, you will be unlucky. So that situation has changed. We have restored some of the values of saying that I'm from so-and-so home or house and I will be there. So you can meet people, although if you are allowed to go. So, but at least people started being together with their wife, their children, their parents. So the family became closer. And the other thing is when the family is closer, for some families, it is a bliss. But for many other families, it is not a bliss because it's constant argument and constant fighting, or sometimes physical abuse, mental abuse, psychological pressures, and things like that. This another challenge a lot of people faced, and there were suicides and that kind of stuff in this. So I happened to hear a joke that, inside it is wife, outside it is corona. So you can neither be in the house or not outside the house. So then the other solution was that soap can solve both problems. So, I mean, although it was a sarcastic or funny statement, but it had some meaning too. So for that also, the Department of Social Welfare and Family Welfare should have stepped up with counseling and things like that. That should come from the government. That's why we are paying taxes. The government should have taken initiative. Should have. I'm saying should have because if it is in this country, it will be. So government should have taken initiatives to work with the families from a social support standpoint to help resolve their problems, or to educate people about peace in the family and how to coexist and all that. Another good thing that happened with this is that world has become smaller. Why world has become smaller? Today I'm sitting in the US and talking to you. If it was 2 years ago, this will not happen. Although I had been using this online platform WebEx for last 8 years. But how many people right now that should have happened only in 22nd century? But are they? And I showed positive. The entire hospital population started looking at me like a wild animal or something. I said, I'm not staying here, I'm going. I don't want to be here. So the people who were more severely sick, I was mild only, but because I had my vaccination, but people who were more severely sick, if they had to get admitted, nobody will even turn to them, although the medical staff, they are all vaccinated and they should be daring, and they are signed for it. They signed an oath saying that they will commit their life for medical profession. But I could see visibly that these people are all running away. So if the patient is even calling for help, nobody will show up. I hope I'm not exaggerating, but this was a phenomenon that was happening there. If any of the doctors are here, please do not feel offended, but this is, we should have done that a little more better. A lot of isolation, and plus the general public. What were you doing? I could not come to Chenganur because my brother told me that the neighbors will throw stones at me. Why? How can we do that? how can we hate people just because somebody is sick? So at one time, anybody who was coming from Middle East, Dubai or somewhere, they were being chased away. If you remember last year in April, May, June time, anyways, they were being seen as some kind of outcast or something like that. And those kind of social isolation had been happening and even happening even now. I think as a society, you people, particularly the student community, should think about it, make your own workshops, make your own seminars, make decisions and pursue to stop that kind of abuse. If the medical frontliners are signed for helping patients and that they chose that profession, just like military, when I joined military, I signed to commit my life to protect the nation. And same way, these medical frontliners, they signed with a commitment to protect the patients. So regardless of what happens to them, although I understand they are family people, they have husband, wife, children and all that, within reason, they have to be available. And that's why we gave them the vaccination when we were not getting the vaccination. So then other thing that's happening is fear of uncertainty. We don't even know today. Do we know tomorrow when this COVID is going to end? In America, we don't know. Right now, we have some kind of a relief, although not so much relief in Florida, but in northern part where we live, there is some kind of a relief. Even we ourselves don't know what is going to happen in 2 months. People say it's coming back. So same thing in Kerala. Do we really know tomorrow what's going to happen? Right now, India's COVID population per day is 34,000 and 27,000, 26,000 plus is in Kerala. Why? Nobody knows. So it is a lot of uncertainties there. That's the negative side. Another thing was religious beliefs and faith challenge. Those people who were meticulously going to church or temple, now they cannot do that. A lot of criticism around that, but months together, places of worship was remaining closed. So this will put some kind of an uncomfortable situation in a lot of people who practice faith in a certain way. And also with the confinement to the house, a lot of young people or even older people who need that exercise and use of their energy, they could not, because you cannot go out. Gymnasiums are closed. No, nobody can go there. With all that, I don't know why they are keeping it closed. I have no idea. But at the same time, you cannot go there. So where are you going to spend that energy? Are you going to do push-ups at your house? How many times? So that became another issue. But COVID also, it is not a completely disappointing thing. There is light at the end of the tunnel. There are some possibilities. As I said before, this confinement to the houses helped us to have increased time with family, which we talked about before. So I'm not going to dwell on that anymore. Like I said before, all these things are known to you already, but we'll go to certain specific things, which is different from there to here, which I will come to later. And better childcare from parents. When earlier you leave your children and go to your work, leave your children to nanny or somebody, but now the children are blessed to have their parents with them and grow up in the hands of their parents. And again, earlier we used to say that I am from so-and-so home, but I am never home. Either I am working in Ernakulam or Kochi or wherever, but I am not home. Whereas now you can really see people in their homes. And also from a health standpoint, food prepared at home, that definitely make a difference from food prepared in a restaurant. Because restaurant people, they want to give you taste, but at what health standard? More oil, more cholesterol, whatever that is. I'm not saying the restaurants are doing something bad to the society. They are businesses. They have to survive. but they are not keeping each individual person's health conditions in mind while preparing the food. But you can have custom-made food in your own home, made with your own dear ones. The other big possibility is that the real cream of the thing, technology. With COVID, the biggest possibility that came was the technology. Like I said before, a person who could not even dream of coming to a video conference is now acting as if he invented it. Everyone has become very, very familiar with it. A year ago, or in 20 up to 2019 end or 2020 beginning, and all that, they became familiar with that. And on top of that, all spiritual activities, when the churches in my town, Idayarmala, few days I attended that because somebody 1,000 kilometers away. Is that not amazing? And all this happened in a month. And so earlier, book a place and everybody come together and dance there and do whatever. Whereas now, all these things for that, assume that this corona happened about 20 years ago. If this COVID situation was 20 years ago, these kind of online resources were not available. Even cell phones were not available. What should have been the state of things? Did anybody think about it? Today, Corona came, along with Zoom also came. So everyone is on Zoom, or on WebEx, or on Microsoft Teams, something. So we are blessed in that sense, because if this COVID was not there, these things should have become commonplace by next century, or at least after 20 years or 15, 20 years more. So we went so much ahead in moving the time machine. And same thing with the cultural activities. I don't have to go in detail on that because same thing applies there. So let's move on to something that we all call in America. That's where we are going to talk different. Up to now, whatever I discussed is not a new thing to you. You people know this better than I do. But now we are going to talk about certain things that is little different from what I know is the talk of the town in Kerala. Because when I was there, no one talked about these things there. In the US, we have something called the new normal. What is new normal? We talked about a lot of it right now. Remote work practices, including teachers and doctors, can work from remote locations. I do not call them work from home. When it is work from home, that is work from kitchen. So in my company, we have a lot of remote working, but I will not let anybody use that word work from home, because work from home becomes work from kitchen. So, but we call it remote work. So and so is working remotely today. But for that, certain conditions have to be met. But I don't think so in India, in Kerala, we enforce any of those things. If you want to work remotely, you need to have a workstation in your place. You need to have wired internet service. You need to have privacy of work. You cannot have children coming and knocking your door all the time, or a wife or a husband coming and bothering. So if you are not able to efficiently work from the remote location, then you take leave. They can say that, oh, we did not make Corona. Okay, that's why we have a new normal, that if you want to work from a remote location, you have to work. If these people who are drawing the salary but not able to work efficiently or as productively as before because of Corona, it is not really an excuse. We have to learn in the new normal. We should know the new normal is working from remote. And for that, we have to find system of working from remote efficiently and productively. Same thing goes with the remote schooling practices. We talked about it before. We know with the corona, schools are all closed, colleges are closed, but somehow we had to move on. For some time they remain closed. Then we brought up something called remote teaching or online teaching. But what kind of training was there? Maybe it was there. Correct me if I'm wrong. But not to my knowledge. There was no immediate action from government to organize training and workshops and seminars for the teachers to do their work efficiently. But if we can do that efficiently, we can easily become part of 22nd century. Because school, although it has a social negative angle, but at least the schooling from remote locations help us to educate ourselves, although not for social reasons, but at least the education can happen, provided proper training is given to the educators and proper training is given to the children to make them ready for that remote education. And we also learned in the new normal to have a wedding with 20 people, to have a funeral service with 10 people. So that became a new normal. What is wrong? Nothing is wrong. Still funeral is happening, still wedding is happening. So the 2,000 people, 4,000 people type of weddings are stopped. Maybe it's a blessing in disgrace. I would say it's a blessing in disgrace. And same thing with online shopping. With this Amazon shopping system was popular in America before. But now I can see in Kerala, Amazon is more active there. Amazon work with more efficiency there. See, that saves your petrol expenses, that saves time expenses, that saves a lot of things. So Corona did contribute to help us to move to another system of living. And same thing goes to the digital inventions for a social and cultural life. I did tell you about the Onam that we went through. So that's a new normal. Nobody is coming 500 people together for a conference. Today we had this conference. If it was supposed to happen more than a year ago, you may invite me. I may have to find a time when I come to Kerala to come and speak there. But today we can sit here and speak to you and as if I am with you. And also environmental pollution. With the number of cars reduced on the street, when the number of vehicles less on the road, the pollution has reduced, and also the congestion on the road also has reduced. I was driving around in Kochi and I could clearly see the difference. If earlier it will take 10 minutes for us to move 1 kilometer, now we could kind of freely travel. That also became a new normal, but that new normal is a blessing. And the crowding, which we talked about before, the crowding also has reduced a lot. So with that said, let's move to the next call for and call for other social religious leaders action. Because these are the people who are shaping the future. In shaping every child future, every student who is in BIM college and their future, they have a big role, and their government has a big role, and their leaders have a big role. So let's look at our own individual role. If I look at the employee population, every one of us has to upgrade ourselves for a sustainable, efficient, and productive remote working condition. If we are happy with 50% production and delaying the services, whatever we are doing, it can only sustain for so long. It can go for a year, not more. Someday people are going to react. Someday there will be revolution that they can't they cannot continue to pay the same salary for all these government employees, but they don't get services in the name of COVID. So if you can do only 50% work, then take only 50% salary. So that all will become difficult thing. Then how are they going to live their families? How are they going to meet their expenses? So the only solution, the call for action for every employee, every one of you who is listening to me, is to make sure that you are ready for the new normal. That is call for action on your side. Prepare your children for successful learning, for the survival of their own future. The students who are in the college, they do not have to be prepared by parents, but kids who are in the school, they need to be prepared by the parents by purchasing the smart devices for them, or even educating them how to handle online classes efficiently. And the next one is be willing to accept less. Sorry, the word is wrong. Accept the less crowd at the family events such as wedding, funerals, etc. Don't be disappointed. If only 20 people came for your marriage, or I think they allow 100 or 50 people. When I went for a couple of marriages, they allowed 100. So if only 100 people came for a marriage, still marriage is marriage. Why you need 2,000 people? Why you want to block everyone from their work? So we have to prepare ourselves to accept that kind of small crowds. So we had to develop a mindset for that. And also make yourself equipped with adequate skill and knowledge for smart online shopping. Earlier, when we go to a shop, we want to buy something, we will negotiate. I think in Kerala, negotiation is a normal way of life. But now with online, you cannot negotiate. But in online also you have techniques of purchasing it cheaper. There are coupons. There are you can go to multiple resources. You can go to multiple outlets. You don't have to go to Amazon for everything. There are other suppliers who can supply. So there is a way to compare the prices. For that, you should have a skill. So you have to upgrade yourself. Not just I'm talking to my teacher friends there, that don't depend on your children for everything. You have to upgrade yourself. I'm 67 years old, and I think I can handle it myself because it is my need. I'm not going to depend on my children for doing my things. So the older population has to upgrade themselves, otherwise you'll be so fed up with the new system. So please, call for action is for you to upgrade yourself to handle your things in a smart way, or purchase things at the right price. Also, we need to accept virtual celebrations, conferences, meetings, and prepare to participate efficiently. If assume that there's a teachers' conference. And teachers' conference earlier, you all traveled and went there, sat there, listened to it, and then came on. But today, you may have to attend from remote location. If I am attending this meeting today remotely, and if I'm not able to do it efficiently, which I'm pretty sure some of you may have had some concerns that I may not be able to handle, I can handle. But I can see more qualified people than me. Occasionally, I see them not able to handle because they are not ready to prepare themselves. They are not ready for that call for action. They just want to be old-fashioned. Oh, I'm so many years old, so I'm not going to study. I'm not going to learn any new tricks. I'm old dog. So in English there is a saying that old dogs does not want to learn new tricks. So I'm not going to learn any new tricks. When the smartphone came, many of these people then they were not ready to accept smartphone. They wanted a phone that where they can push buttons and make a phone call. But now all these people have become gurus of WhatsApp and all that. So you need to prepare yourself for being part of that efficient system. And also we should learn rather than despising all the time, rather than being unhappy all the time, saying that, oh, I'm tired of sitting at home, I'm tired of watching movies in the house. No, you need to enjoy the better environment. Well, it's less pollution, it's less noise. So when you spend time at home, you should be enjoying, and also you should be enjoying the less pollution, less polluted environment outside your home, where you can walk into a park if allowed and get some fresh air. Whereas earlier, if you go to park, there will be 200 people there. So where are you going to get a fresh air? Having said that, let's move to call for collective action, call for your action, and call for collective action. Collective action should come from government as well as from religious leaders. The last thing what I said is going to irritate some of you maybe. In our system, the main problem is either the government or the elders or the religious leaders. Example. In America, anybody who is getting married can get married on a Saturday, because Saturday is only holiday available. If on a working day, because my religion has a belief that Monday or Thursday are the only good days for marriage. These are all beliefs made by people. If that belief is the God-given belief, then that belief should be there in the US also. So for this collective action, first of all, government and the religious leaders have to give some leadership. I hope you will agree with me. Before COVID also, I used to talk about it. In Kochi, where I have an office, is not half efficient as my US office, because every day a couple of people are on leave. Every day I had to ask how many people are on leave. Whereas in the US, I don't have to ask a question. Nobody is on leave. And is it their fault? No. The fault is either in the system, because their friend does not want to do a housewarming on a Saturday. The housewarming has to be on a Tuesday. Then only the house will get warmed. These beliefs. So those belief system need to change in line with the new normal. If the new normal is to have remote things, then it has to happen like that. Anyway, let's go through the order. Governmental preparation to accept and enable the new normal. What has done? I'm not trying to blame any government, but the government also are made up of human beings. Human beings who draw handsome salaries. And people managed by the so-called IAS, IPS services who are supposed to be super brains. If an IAS officer is not a super brain, then what is a hoo-ha in selecting them? If they are supposed to be more efficient than you and I. And why did they prepare the government? Did they prepare the society? Did they prepare the state to accept the new normal? What are their duties? I think you people, I'm just opening a discussion there. You people as a student population, as a teachers population, you should think that, did our government do? I'm not talking about any party or politics or anything here. Did our government do what they are supposed to do? Are you getting the returns of your taxes? Probably I'm saying this because in the US, we own the government. Government don't own us. In the monarchy rule, the king owned the subjects. Subjects have to give taxes, whether the services are coming or not. But in a democracy, no, government is owned by the people. So we can decide whether we need a government or not. Probably you must have heard in America, government shut down, because we can shut down the damn government. So that kind of an awareness should be there in the government and government managers. So again, you and I cannot help it. They have to know it, but we can talk about it. We can make a hue and cry about it. So the government will prepare the state for them to accept the new normal. Then retrain family and social welfare officers to decide. We talked about it before. Implement and manage new normal practice of the society. Again, that's a governmental duty. They have all these departments. Family welfare department is there, but what they are doing, God knows. There is a health department there. Every department is there. A lot of people are getting a lot of salary, But are they doing their service? With the COVID, I think some good services are coming from the health department. They will follow up with you and all that. But they are following up for what? I'm not going any further with that because suddenly I stopped because I quickly remembered what follow-up they were doing with me. It's just harassment, nothing more. Then prepare and train the healthcare providers for new normal, for effective telemedical system, telemedicine, and patient care. It can be done. It is being done. So, but you cannot just have a patient and oh, okay, it is a distant treatment and all that, but don't give any treatment, and the patient die. I lost 2 people in my family. Through this, one in Abu Dhabi and one in the US. Then continuing education to educate the educators. We touched off before, educating the educators is a major challenge for the new normal. So even colleges should have their own programs for doing that, and government should have checks and balances on that, whether the colleges, private colleges, and other people are doing it or not. But without this, we will not be able to embrace the new normal. Virtual classroom should become normal. Virtual education should become normal. Virtual teaching should become normal. I think we are running out of time now, but I think it's only one more slide. So religious leaders. Again, we talked about it, so I'm just putting a final touch to that. Religious leaders should know their duty. So of re-educating their folks, re-educating their believers that, look, God will listen to your prayers not without even coming to church or coming to temple. So those kind of belief system change in line with the whole world and with the new normal particularly should be embraced. And with that, so the major point of our discussion today is what is new normal and what is called for action. If we are ready to accept the new normal, and if we are ready to do our part in efficiently running the new normal, the society will become a capable society and you can take advantage of this pandemic. With that said, I will conclude and I will leave the rest of the time for any questions. I can answer it from the US perspective because whatever I know from Kerala, you also know. I'm not a guru of the things there, but how we practice certain things, we can tell you if you have questions. With that, thank you very much for listening to me and thank you for having me and appreciate the opportunity. Thanks a lot. Appreciate it.
Thank you, sir. Thank you for your wonderful talk. It was an informative one. So this is the time for discussions and reflections. Dear participants, you can ask questions. You can clear your doubts. Okay, all type of questions are welcome.
The new normal is for anybody have questions, write down the questions on chat box and the host bring up those questions. And otherwise for the first person, the first question is the most difficult part.
So any questions, please?
Yes, please go ahead.
Sir, I'm Arun Matthew, and it's a wonderful session. And I noticed that, as you said, we have to enhance efficiency and productivity. But I would like to notice a comparison between the Kerala model and the Delhi model of COVID operation. Because around 1 month ago, I have visited North India, especially Delhi, Haryana, and Rajasthan. In North India, there is nobody wearing masks, and there is no social distancing. Once I was traveling in a bus, the only person weared mask, that is me, and the rest are not wearing masks. And there is no social distancing in a bus. It's a journey from Alwar to New Delhi, Rajasthan, from Rajasthan to New Delhi. So I'm in that crowd, and at that time I thought when I reaches Kerala, I will be affected by COVID. God grace has escaped. So in Delhi, everything is fine. Nobody sitting in home. Everybody going for their job, and the officials too not wearing mask. And when I'm wearing mask, they looks me as a COVID positive one. But in Kerala, everybody in fear. And
I think I got the point.
wearing
I think I got the point for moving forward.
and keeping social distancing.
Can I?
So, sir, I'm asking about, I think Delhi, they got herd immunity, and they are free from COVID now. They are operating well. But in Kerala, I think we don't have herd immunity, and we are struggling with COVID. So, which model is better, sir?
Sir, can you hear me?
Yes, I can
you
hear
hear me?
you.
I think there is some errors in the network while our participant replied. So you can proceed, sir. I think you got the facts of the question.
I got the question. He was talking about, if he can hear me, he was talking about he was in Delhi, and in Delhi he was the only one who wore mask, and people looked at him as some kind of strange being from another planet or something like that. It's correct. Unfortunately, in your country, you do not have the liberty to decide what you can do and what you cannot do when it comes to this matter. So in our country, it is our sweet choice whether we want to wear a mask or we don't want to wear a mask. Government can only give directives, guidelines, and everyone follow the guidelines. That is responsible citizenry. But they cannot enforce it by law because that's your civil liberty. So, but India's administration is a little different. So if the Kerala government is enforcing double masking and all that, it is their vision of doing things. But when you went to Delhi, the COVID cases are so low now. So it is safe to walk around without mask.
जनरल प्रमोशन इसी के लिए कुछ कर रहे होंगे मालूम है लोग अब रायपुर से लीक हो रहा है यूनिवर्सिटी से लीक हो रहा है
So this Lily's honey need to be muted. So that is the reason. So when you are in Rome, you have to be like a Roman. So when you're in Delhi, if everybody is moving around without a mask, you also move around without a mask. I don't think so. It is a very serious matter. And in Kerala, it is there are directives and rules that cops can enforce it on you, which is very strange to me. But that is the way it is, and you have to be compliant. That's the answer, I believe.
Thank you, sir. Any other questions from the side of participants?
Sir, I'm Alfie. I'm from history. Sir, can you hear me?
Alfie, I can hear you.
Sir, due to this COVID issue, schools are closed since 2019. And also there is many issues related to online classes such as range issue and health issue. And we the students are very disappointed with this current system. And so I think homeschooling is a very familiar education system in US. And it's not familiar in India and practical sides of homeschooling. I'm not just asking about the online classes. I'm asking about the homeschooling education system.
It's a good question. Homeschooling is a practice that was in existence in the US before I came to this country. That means at least more than 30 or 40 or 50 years. So they will get the school syllabuses, and there are homeschooling systems nationally. So they will send you all the study materials, and parents help them help teach the children, and they pass the exam. But there are certain social sides of it. If a homeschooled child may not have the social skills of a child who learned in a regular school. So going to school is not only to educate your brain about science and math, but also to learn the skills to coexist with others, with your peers. So those kind of skills may not be there. But the other advantage is that since you're not going to school, you won't learn to smoke, you won't learn to do other crazy things that is rampant in the school. And also in the school, here in the school, there is no school prayer or anything like that, because that is separation of church and state. So you can be better disciplined when you are homeschooling, but there will be social skills. Everything has a cost. So you can be homeschooled and you can be a more disciplined person, but you will suffer from the social skills end. And this is a challenge with the online education also. When you are sitting in your home and studying with the help of a little smartphone or even a tablet or a laptop, you are learning, but at the same time, do you know how to go out with your friend for a cup of coffee? Do you know how to play with the person? Do you know how to make friendship? You know how to grow friendship? Do you know the value of friends? All those things will be a challenge. That will be the negative of it. But so you need to go around that. Schooling is one thing, learning is another. Learning is one thing, but also parents should be aware and alert to educate their children so that they can be competent in the society. Did I answer your question, Alfie?
Yes, sir. Thank you, sir.
Welcome.
Any other questions?
Thank you, sir.
may
It's a
I-
wonderful section. I was listening, and you mentioned about the merit and demerit, and also the blessing in case. So I was listening. So new things, the catastrophe, the pandemic situation made a new lesson to us. That means the initial time, even government, other agencies, even everyone were failed, but we do not know how to overcome. After that, the failure made a lesson we have tried to overcome. So the first long time lockdown, such and things were implemented. Even the case reporting from 1 or 2, we were afraid. We closed the state market and bus service everything. Now the case is increasing. So I was listening very thank you, wonderful section. So the men like the intelligent group we claim are very much afraid about the small microorganisms, the insect with the coronavirus. Anyway, this given a new lesson to the humanity. We must be prepared ourselves, and also one more joint things. Even the device like the mobile, such and things, the teachers and other students were not much familiar initial time. So now we came to the platform. All were interested and all nailing many technique like Zoom, Teams of many other technology. Even the teenage and till students and even schooling all were learning. So new innovations, scientific method were adopted. So it's a positive thing, as you said. At the same time, social relation and psychological depression and social disharmony, then family disintegration, then and the fellowship in family and personal religion was going down. So we were attached with the instrument. There's no much knowledge in from surrounding socialization. It's not at all happening. So that thing happening in other side. When unfortunately our country is not that much developed, we never thought we would go this kind of situation in initial time. Okay, but now people are bigger, the industries, daily wages and all are there. If they are not working every day, they cannot survive. So every day they must work. That kind of marginalized people are there. So another thing in schooling, remote area, people living, they are not getting proper range. Even they are not able to charge their mobile. Even system were poor. They are not getting proper money. Not like the rich country. Even now also, we don't know how much percent of students are attending the online. Even though they are attending, how much they are enriched. Even and also even they attending, are they just opening the system or getting the knowledge or getting the means communication properly also be a problem. For example, in high area and remote coastal area, difficulties are there. In urban area, semi-urban place may be okay. So when you're not able to understand the things are there, very sad things are going on. So we are all things are working together. At the same time, the lesson you taught us call for action. Of course, the young generation are more vibrant. People in the middle and old generation, especially educationists, teachers, were also prompt to act, prompt to learn. They also came to, even people like me also understand the network system and new technique and technology. Thank you for your wonderful, very innovative and also thoughtful, especially in the midnight. You wake up and to do this to provide deep and cognitive intensive knowledge to society on behalf of the community and our institution, the beloved teachers and all the comments helped me to express thanks. Okay, so thank you. And
Hello.
We'll have
Hello, excuse me. There was a question which was raised by Anil Askaria in the chat box. Can I read it out for a quick response, sir? Is it okay?
Please.
Yeah. The question is, how can we ensure equity and quality education in our higher education system during the COVID-19 pandemic. Can you share your valuable thoughts?
Yeah, I think I already said that twice. The quality education system has to come from the thought process of the elders. Children or the students cannot do a lot of help there. Students need to be given that resources. So to begin with, although we started this online education system in an emergency, but now we went through the emergency for more than 1 year. By this time, we should have taken initiatives from a governmental level to educate or retrain the trainers, educate the educators. It's a very common phrase here in America, educating the educators. So there should be continuing education system for the educators. So this call of the duty or call for action from the government side and also from institutional side, from the management side should be there to re-educate the educators, to educate them so that the quality education is imparted and the children or the students are enriched with the education for which they are paying money.
Okay, sir. Thank you.
Welcome.
Dear participants, you have any other questions? Okay, I think there is no other questions. Last time Abraham Kurian posed some questions related to normal and new normal life. I think normal and new normal life is the point of our discussion, but a majority of people were below the so-called normal life before COVID itself. Now the gap between the normal and below normal are widening. How can we overcome this divide between this normal and new normal life, especially normal and below normal life? So these some questions are there. I'm not taking too much time on that because we need some discussions on that point. We will proceed that in the next sessions also. So thank you, sir, for your wonderful session. We are grateful to you. You spent your resume time for us beyond time zones. Now we are together. We shared a common thought, normal and new normal life. We think that about how to cope up with the situation. To express our gratitude, I invite Anu Saravargis, our student representative, to express our gratitude. Please, Anu, please.
Thank you, sir. Good morning, all of you. We have come to the end of the webinar session. On behalf of Bishop Abraham Memorial College, Thuruthicad, I would like to thank our keynote speaker, Thomas Joseph, for such a wonderful and informative session on socio-economic impact of COVID-19. We enjoy a lot your section, sir.
Thank you, Arvind. Thank you for having me. We have a question from Christina, but Christina, I'll contact you privately and talk about it. Christina also is my niece.
Thank you, sir. Next, I would like to thank Dr. Abraham Kurian Faculty, Department of History, for delivering the welcome speech. On this occasion, I would also like to thank the program directors, coordinators, online supporters, students and participants for making this webinar a great success. Once again, I thank one and all present here. Thank you.
Thank you, sir. Thank you, Anu. The session is over. Okay, sir.
Thank you. Thank you for the opportunity, and please feel free to contact me anytime for any support that I can do.
Okay, thank you, sir.
For Dr. Jasi Matthew, who was mediating the whole thing.
Yeah, okay. Thank you, sir. Thank you.
I'm very thankful to you for accepting my invitation
Oh,
and spending your valuable time.
I can't say no to you. And also, Dr. Joseph,